We found that people who did tongue scraping typically had the most diverse oral microbiome, and they typically had the best management of blood pressure. However, if you use a tongue scraper and you use mouthwash, we saw the greatest increase in blood pressure.
Hi, everyone. My name is Dr. Josh Helman, and I am really excited today because I get to interview someone I hold in high esteem. I actually went to a pre-conference he organized last year at the A4M, the Anti-Aging Conference. This is Dr. Nathan Bryan, who's a professor at Baylor. So, this was like a full 8-hour full day on nitric oxide. And now I get to interview you on, I guess we only have, a limited amount of time. We're not going to talk 8 hours on nitric oxide, but
we could.
Actually, we could, but we're not going to do it this time. So, but I am so excited to be talking to you about nitric oxide because this molecule is, to me, is like one of the top 2 anti-aging molecules that affects so many different normal physiological processes and I think controls aging and also has an impact on Alzheimer's. So,
for sure,
Dr. Bryan, thank you so much for agreeing to be interviewed. And welcome.
Well, thanks, Dr. Helman. It's a great honor and pleasure, and thanks for coming to the A4M pre-con. I think we'll certainly get into that, but yeah, what you're doing is so important in getting this information out to the masses. So it's not just about educating and training new physicians or existing physicians, but really educating the masses and the public, and so people can have access to this information outside the physician's office.
Yeah, and so let's take a step back because you're a PhD, and you could have studied any field, and certainly any field in science. How in the world did you figure out nitric oxide? I mean, I know it won the Nobel Prize in 1998, but I'm thinking maybe you started this path before 1998. What do you think?
Well, as any career is yours, it's a journey, right? I started out always interested in science and medicine. I did well in high school, graduated top of my class. Then I went to the University of Texas and got an undergraduate degree in biochemistry. And I can remember the inorganic chemistry class. Once I got through that, I was like, I never want to deal with nitrogen-based chemistry ever again. I'm done with it. I'm going to do it. And then fast forward, 25, 30 years, and that's all I've spent the past 25 years really in the trenches trying to understand nitrogen-based chemistry.
Wow. And I'm just curious, what was it about nitrogen chemistry that, was it just too complicated, or what was it about nitrogen chemistry?
Yeah, if you remember back from basic inorganic chemistry, I mean, it has, 8 different oxidation states, 5 valence electrons, it reacts with a lot of things. You're thinking, holy man, how do we control and dictate the metabolic fate of nitrogen-based compounds? And it's the most abundant element in the earth. The air we breathe is 78% nitrogen. It's fixed by lightning fixation. And, so there's a lot going on in the environment and now in the human body as it relates to nitrogen. And, we focus strictly on nitric oxide. But once you went through this same process, once you get a bachelor's degree and you really, to understand and to really have a meaningful career, and especially in science and medicine, you have to get advanced degrees. And so for me, I did undergraduate research at UT, and I fell in love with this feeling of discovery and really the intellectual freedom to be able to answer any question you want under the sun, and then be able to design an experiment to get an answer to that question. I mean, to me, there's no greater career that allows that much intellectual freedom. So from there, I went to LSU at School of Medicine, and I got a degree in PhD in molecular and cellular physiology. And then I went to Boston, trained as a cardiology fellow in the Whitaker Cardiovascular Institute. Did a 2-year postdoc, and then I was hired by Fred Murad, one of the gentlemen who shared in the Nobel Prize.
Oh, wow.
But it was really during my time as a student at LSU, because the Nobel Prize had just been awarded. Lou Ignarro, one of the other gentlemen, came and gave a lecture in our class, and had a chance to have dinner with him and discuss this molecule, nitric oxide. But from there, it was, I delved into it and spent the past 25 years trying to understand this very simple molecule.
That is so cool. And let me ask you, so for the general audience, nitric oxide is just simply one nitrogen and one oxygen atoms stuck together. But is it? I mean, because from what you just said and from what I remember, you've got 3 or 5 valence electrons. And I mean, does Isn't nitric oxide, isn't that molecule highly reactive too?
It is. Well, it's a free radical. So it is one
Yeah.
nitrogen, one oxygen, but it's got an unpaired electron. So it's you were taught, most of us were taught that free radicals are these toxic, damaging molecules. It's highly reactive. The nitric oxide is unlike like oxygen radicals, which are certainly toxic and damaging. But because of the dipole moment that occurs between a nitrogen and oxygen bond, nitric oxide likes to donate its electron. And we know from just basic chemistry and biochemistry that any molecule that donates an electron is an anti-inflammatory, antioxidant that leads to, reductions or gains of electron. And all that's fundamental to normal physiology. But yeah, there's a finite number of targets for nitric oxide. It binds to metals and it signals through binding of primarily hemoproteins like monocyclase or hemoglobin, but it also binds to cysteine thiols. And so without getting too technical, it's not that reactive. There are known reaction kinetics. We can really understand when nitric oxide is produced, where does it go, what does it become? And now we can dictate and control that metabolic fate when we develop nitric oxide-based therapies.
Yeah, and it can also, and again, I've got 2 degrees in biochemistry, and we're not going to go deep down into that stuff. Yeah. But one of my favorite molecules, the nitric oxide, it can combine with oxygen, right, and to form something I call the oh no. Is that right?
Well, that's the reaction with nitric oxide and superoxide. So superoxide is an oxygen radical. And in fact, one of the primary antioxidant effects of NO reaction with superoxide is it quenches these oxygen radicals. And then it forms this intermediate called ONOO minus or proxynitride. And for 20 years, we thought that was kind of a toxic, damaging molecule, but it basically just rearranges into inorganic nitrate, which is NO3 minus. It's a proxynitride. It's a cage-like molecule that if you get some biomolecules in close proximity when it's formed, it can nitrate them, form nitrotyrosine residues, and render protein dysfunction. But primarily, it's an antioxidant reaction. Nitric oxide scavenges superoxide production and basically turns it into an inert molecule nitrate.
Got it. So it's being helpful. So the first time I think I ran across nitric oxide in medical school, we were talking about it for its ability to open up blood vessels.
That's right. Yeah. So its first, really the reason it was discovered in its primary, action was a vasodilator. So the first pathway to be discovered was it's produced in the lining of the blood vessel, and it causes fluid muscle to relax, and it opens up the blood vessel. So it improves, tissue oxygenation, improves blood flow. And in fact, I'm guessing because I taught in medical schools for a number of years, that the primary action was at explaining ischemic heart disease and the primary therapy of nitroglycerin, because it's metabolized into nitric oxide, dilates the coronary arteries, and it's the cornerstone therapy for ischemic heart disease and angina.
Right. And I think we know now that when you eat leafy greens, your body is naturally going to produce nitric oxide, naturally through bacteria in your mouth and in your gut, will convert the nitrates in leafy greens and similar vegetables into nitric oxide. Is that right?
Yeah, so the body can, but unfortunately in most Americans it doesn't. That's really a problem because, if again this pathway is dependent upon getting enough nitrate from the vegetables. We know that the vegetables that we eat in America are typically depleted of many nutrients, including nitrate. It's also dependent upon the oral bacteria. 2 out of 3 Americans wake up every morning and use mouthwash, killing the oral microbiome. So in this case, you can eat all the vegetables you want, but if you use mouthwash, you don't get any nitric oxide benefits. So that's a major problem. And it's really a jaw-dropping moment for a lot of people. They go, oh, the mouthwash I'm using is decreasing my nitric oxide production. Yes, it's increasing your blood pressure and you lose the protective benefits of exercise.
Right. And to be clear, what's going on. So, for example, if you have a mouthwash with fluoride in it, the fluoride itself is going to kill the good bugs that would normally grow in your mouth.
Yeah, it's the fluoride, which is an antiseptic itself. It's the alcohol-based antiseptics. Really, anything that's labeled as antiseptic, whether it's chlorine, or chlorhexidine, Listerine, Scope, any antiseptic mouthwash, or any fluoride rinse, is non-selective in its killing of bacteria. It kills the bad guys, but the collateral damage is really enormous, and it ends up killing all the good bacteria, and there are clinical consequences to that.
Wow. So, and how about this? I've seen research that for some reason tongue scraping will improve the bacteria in your mouth to want to produce more nitric oxide. Are you familiar with that? Do you agree with that?
Yeah, we were the first people to publish that study in 2019.
Oh, wow.
We found
Okay.
that in normal, healthy individuals, we found that the people who have the best blood pressure, and these were dental students and dental hygienic students, and we took young, healthy medical school, dental school faculty and staff and students, and then we just measured their blood pressure. We practiced different oral hygienic techniques. We found that people who did tongue scraping typically had the most diverse oral microbiome, and they typically had the best management of blood pressure. However, if you use a tongue scraper and you use mouthwash, we saw the greatest increase in blood pressure. I mean, we saw sometimes a 25, 30 millimeter increase in blood pressure for 7 days of using mouthwash if you scrape your tongue and use mouthwash. So I think to explain that, when you scrape your tongue, you're opening up the crypts of the tongue and really kind of tilling the soil. Then when you apply an anesthetic to it, you get better effective killing of all the bacteria. And that's not a good thing. So tongue scraping alone, we think, is probably beneficial in terms of tilling the soil and cultivating the bacteria and increasing the diversity of the microbiome. But if you tongue scrape and use mouthwash, it's probably the worst thing you can do.
Fascinating. Were there any other oral habits that you found that are helpful to increase the nitric oxide?
No, I mean, just tongue scraping. Look, this wasn't an exhaustive study. We were kind of doing kind of what was normal. And really, we didn't choose for these or to select for these. We just did, kind of surveys, and we found that some people were tongue scraping. Some people were flossing. A lot of people were using fluorinated toothpaste. Some were using a non-fluorinated toothpaste. So now we recommend don't use mouthwash. Do not use fluoride in your toothpaste. That preserves the integrity of the microbiome and increases the diversity. So now these bacteria can do things that we as humans can't do. And that's the whole purpose of the microbiome, right? Not just the oral microbiome, but the gut microbiome.
Exactly. So we've both seen, the effects of, nitroglycerin and obviously nitric oxide and being able to lower blood pressure. And unfortunately, most Americans, as they get older, their blood pressure goes up and up and up in our Western society. So that can make a huge difference. And as you suggested, most people in our country are not taking in lots of green leafy vegetables. So apart from doing that, how else can you increase your nitric oxide?
Well, going back to that statement, it's no surprising why Americans are the sickest people on the planet, because the standard American diet is horrible. Everything we do seems to disrupt. There's 2 out of 3 Americans are using mouthwash every day. We overprescribe antibiotics in the clinic. And there's 200 million prescriptions written for antacids every year. And that's not even counting the over-the-counter purchases. So all these things disrupt nitric oxide production. It leads to this age-related decrease in nitric oxide production. Your blood pressure goes up. And hypertension is the number one risk factor for the number one killer, which is cardiovascular disease. And now we're finding that if you lose the ability to produce nitric oxide, you develop metabolic disease, lose the regulation of blood flow, which sets the stage for every major chronic disease around. So to answer your question, we have to do 2 things. We have to stop doing the things that disrupt nitric oxide production and start doing the things that promote it. So we can address those one by one. So get rid of fluoride, get rid of mouthwash. If you're on antacid, you have to figure out how to wean off antacids. Now you can just throw in some more green leafy vegetables. Moderate physical exercise stimulates and activates nitric oxide production. 20 to 30 minutes of sunlight. There's certain wavelengths of light on both ends of the visible spectrum or the entire spectrum that can release and stimulate nitric oxide production. So 20, 30 minutes of sunlight on a large part of the body, or, infrared light. I'm a big fan of infrared light therapy. I sit in an infrared sauna every day, and that far infrared and really full spectrum infrared, this has a positive effect on nitric oxide production.
That's awesome. And just to backtrack just for a second, you mentioned avoid mouthwash with alcohol and fluoride. What about other mouthwashes that maybe have essential oils? Is it okay to use other mouthwashes then?
Well, the truth is we don't know. There's a lot we've learned, but there's still a lot we don't know. And we don't know what effect like essential oils or oil pulling has on the microbiome. We just haven't done the studies. But here's what I think based on kind of what we've seen anecdotally, but not in any controlled clinical trials. If you're using something that's labeled as antiseptic, believe it. It's antiseptic, which means it's going to kill all bacteria. But I think natural products like essential oils, oil pulling, as long as they're not antiseptic and indiscriminately killing all bacteria, it's probably going to be fine. But we hope to eventually get the answers and do those studies in the future. But today we just don't know.
It's fascinating. Yeah, because certain essential oils can have bacterial effects, so yeah, fascinating. Taking a step back, and again, I don't want to get too much in the biochemical weeds. I mean, you and I could geek out on this stuff, but I wanted to get your opinion, because I think one of the reasons why nitric oxide supplements, making sure your levels are high enough, is very important for reversing biologic age, is through the three pathways, mTOR, AMPK, and the sirtuins, that for some reason, the nitric oxide optimizes all three pathways to reverse the biologic clock. That's how I read the literature. Do you agree?
Well, nitric oxide is a signaling molecule, and it affects the structure and function of proteins. It improves blood flow. It improves glucose uptake. It affects mTOR signaling, which is, a major kind of target of anti-aging now, with, low dose rapamycin and showing to improve longevity. If we look at, sirtuins and the effects of intermittent fasting and caloric restriction, all of those are dependent upon the ability of the cell to produce nitric oxide. So if you look at the sirtuin pathway and intermittent fasting, caloric restriction, there's activate a pathway called PGC1 alpha, which leads to mitochondrial biogenesis. But all of that is dependent upon nitric oxide being produced, activating soluble guanylate cyclase, increasing cyclic GMP. So this signaling pathway is very well elucidated. But it all breaks down if the cell cannot make nitric oxide. So the best example is if you have endothelial dysfunction, you have an uncoupled NOS, you can, take things like NAD, rapamycin, do intermittent fasting, caloric restriction, that you're never going to get the induction of mitochondrial biogenesis, which means your cell's going to make more mitochondria to make you more energy efficient. So you're not going to get that effect. So going back to the original premise, nitric oxide is foundational for everything we know about anti-aging, longevity genes, the induction of these genes, and for the alteration of the structure and function of all of these proteins that are not only cytoprotective, but induce everything we know about longevity.
And just as a review for people, the endothelium is just the single cell thick lining of blood vessels that are producing this nitric oxide, that are helping with making blood vessels bigger. And then the mitochondria are in almost every cell, helping produce energy and remove toxins.
That's right.
Yeah.
And nitric oxide controls all of that. It controls the inflammation at the level of the endothelium, so it controls vascular inflammation. It improves and actually controls the metabolism of mitochondria, the efficiency of how well the mitochondria utilize oxygen to make cellular energy, or ATP. It tells our own stem cells to mobilize and differentiate. So another key aspect of really healing and repair and replacing dysfunctional tissues is stem cells. You can't make nitric oxide. The stem cells don't get the signal to go and repair and replace old cells.
So to me, one of the fascinating things is that not only does nitric oxide affect human cells within the body, but bacteria also can use the same molecule, the same nitric oxide, as kind of like a homing agent to help, organize themselves. And it's my opinion that when you increase your nitric oxide, sometimes that will disrupt the ability of bacteria to harm you. What's your opinion on that?
No, that's exactly right. In fact, our innate immune system, the way we kill bacteria when we have an infection in the body is, number one, we mobilize an immune response. So if we have poor vascular function, poorly vascularized areas are more susceptible to infection. So what happens is our immune cells go to the site of infection, and we generate a lot of nitric oxide by the macrophages and neutrophils. And that nitric oxide binds to the iron sulfur centers of bacteria, which is their respiratory kind of energy generating part of the cell, because bacteria are unicellular organisms. And so when you have nitric oxide that binds to the iron sulfur centers, it shuts down their respiration. So it's how the human body kills bacteria that are present in the body. So if your body's not efficient at mobilizing the immune response because you have vascular dysfunction and inflammation, and you can't make nitric oxide, then you don't get effective killing, and you have these infections that persist. And it's not just how we kill off bacteria, but it's also how we kill off invading viruses. Where, it shuts down the replication of viral particles before they actually have a chance to enter into the cell and replicate.
Wow. So it's antibacterial and antiviral. And just to be clear, within human mitochondria, we have iron sulfur centers, but they're not harmed by our own nitric oxide, I hope, right?
No, that's right. There's really an exquisite control of the flow of electrons within the intermitochondrial space. So you get targeted, nitric oxide has specific targets within the mitochondria, the complex 1 and complex 4. And it's a reversible inhibitor. So it allows oxygen to fuse further into tissue. And it's unlike cyanide, which is an irreversible inhibitor, which kills people, right? So nitric oxide is kind of a place taker until it allows oxygen to fuse further into tissue. Then it diffuses off, can bind oxygen, make ATP. So it's really, I'm constantly impressed with the beautiful design of the human body and really cellular biology.
That's fascinating. So, many reviewers are also concerned about brain disease, Alzheimer's. I mean, obviously, if we can get blood vessels like the carotids to open up more blood vessels in the brain to deliver more blood to the brain is going to function better. What other types of research or stories or anecdotes have you seen with nitric oxide improving brain function?
Well, let's get to the basis of Alzheimer's. It's really the basis of any chronic disease, right? So if we look at Alzheimer's, if you look at ischemic heart disease, if we look at pulmonary disease, there's 4 hallmarks of it. There's low blood flow, we call focal ischemia or hypoxia. There's inflammation, oxidative stress, and immune dysfunction. And those are the hallmarks of every chronic disease, including Alzheimer's. And nitric oxide is what controls and regulates all this, right? Nitric oxide opens up the blood vessels, perfuses the organ, reduces inflammation, prevents oxidative stress, and prevents the immune dysfunction. So if we look at Alzheimer's specifically, because that's the focus of kind of this summit and what people are interested in, we now know that Alzheimer's is a metabolic disease, right? In fact, it's been coined diabetes type 3.
Sure.
There's a problem in insulin signaling and glucose uptake. But if you follow the work of Daniel Amen and look at kind of non-invasive imaging with SPECT scans, which tells us how well perfused the brain is, or you can look at functional MRI, different imaging modalities, the hallmarks of Alzheimer's disease or even vascular dementia is there's focal ischemia, meaning there's parts of the brain that don't have enough blood supply. And it's because you have either macrovascular or microvascular dysfunction, and there's loss of regulation of blood flow. And there's an impairment in glucose uptake. Well, nitric oxide is going to dilate the blood vessels, get blood flow to the brain, and it's going to improve glucose uptake, potentiate insulin signaling. So now that gets to the root cause of vascular dementia and Alzheimer's. So now we've got a drug discovery program. We're taking our nitric oxide drugs through a phase 3 clinical trial for Alzheimer's because we were very confident that it addresses the root cause of Alzheimer's. And it's not the amyloid and it's not the tau tangles that are the cause of the disease. Those are the consequences of the disease. And that's why most drugs have failed, because it's the wrong target. We get to the root cause of the underlying pathology.
That's great. And it's amazing that you're at phase 3 now of these trials. In the meantime, even though it's not settled science, as it were, what are some of the, first of all, do you recommend that people take that supplement nitric oxide in addition to eating lots of leafy greens and things like that?
Sure. Well, the first approach is, as a physician, it's lifestyle, right? So but most Americans don't want to change their diet and lifestyle, right?
Right.
We're programmed to take a pill, right? And there is no silver bullet. Nitric oxide is foundational. So yeah, there are hundreds of nitric oxide products on the market. 99% of them don't do anything, right? They contain some amino acids, some nutrients that may provide other benefits, but they don't do anything to nitric oxide. So we actually make products that generate nitric oxide gas. If your body can't make it, we do it for you. And anecdotally, we haven't done these in randomized placebo-controlled clinical trials, but we can see an improvement in cerebral blood flow in patients where we get baseline SPECT or functional MRI. We give them a 30-day regimen of our nitric oxide lozenge. We improve cerebral blood flow. We improve cerebral perfusion, and they improve on a cognition exam. And the improvement in cognition correlates with the improvement in perfusion. So we know mechanistically and clinically that patients get better simply by giving nitric oxide to restore blood flow. We can reduce the vascular inflammation, improve glucose uptake, and we, again, get to the root cause of why they're developing mild cognitive disorders and even Alzheimer's and dementia.
That is so exciting. And and it makes sense. The model, Alzheimer's is just a model. I mean, there are other, you're right, all these other chronic diseases have the same mechanism behind it. And that is so exciting. So when patients take these lozenges, how often are they taking? I mean, my biggest concern from the data I've seen is, you eat green leafy vegetables, the spike in nitric oxide is only going to last a few hours. So unless you're eating green leafy vegetables every 4 hours or so, and I'm not opposed to it, but I don't really want to wake up at 2 a.m. and eat green leafies. What are some strategies you could provide so that the nitric oxide lasts for more than a few hours?
Yeah. You think patient compliance is bad now. Try to convince the patient to eat just over 2 to 3 hours. Yeah.
Right. I remember putting on, on cardiac patients, heart patients, nitroglycerin. You put an inch of nitro paste on, and it only lasts for like an hour. So you gotta be putting on an inch every hour.
Yeah. No, again, the body is so amazing in its ability to propagate nitric oxide based signaling. So, and perhaps we failed to mention this, but when nitric oxide is produced in the body, it has a half-life of less than a second. So it's produced and it's gone. It hits its target, activates different pathways, and then it's gone. It's either oxidized to nitrite or nitrate or binds to proteins or metals. So what happens is when it's produced, it's oxidized to nitrite. So now the physiological half-life of nitrite is about 110 minutes. And then it also binds to the cysteine of glutathione. Glutathione, it's a topic of discussion on its own, but it's a tripeptide with a cysteine residue kind of in the middle. And when NO binds to the cysteine residue of glutathione, now you have circulating S-nitrosoglutathione, which is vasoactive, propagates nitric oxide-based signaling. And now you've gone from the half-life of 1 millisecond up to tens of minutes and hours. But you've got to fuel the system and give the body what it needs. So when you eat green leafy vegetables, it takes 90 minutes for your body to completely extract the nitrate from the vegetables, concentrate it in our salivary glands. And now when we salivate, so 90 minutes after we eat that spinach or arugula or beets or whatever it is, then for the next 6, 8, 10 hours, we salivate. The bacteria reduce the nitrate to nitrite. We swallow the nitrite that's in our saliva. It becomes nitric oxide gas. There's a lot of cysteine residues in the saliva, in the stomach, and it just creates this hierarchy of nitric oxide-based signaling that basically lasts for several hours.
Wow. Okay.
And then you can actually activate more by moderate physical exercise, sunlight. So the body has this way to maintain normal levels of nitric oxide-based signaling. And the enzyme in the endothelium is what's responsible for kind of the second-to-second regulation. After we eat, we have to increase blood flow to the gut and divert it away from other tissues, right? So then that's you shuttle that and control that regulation of blood flow through nitric oxide.
That's fascinating. What is your opinion about? I mean, there's certain things that people consume, like caffeine, for example. We know that caffeine will decrease nitric oxide levels. So, do you recommend people stay away from caffeine, or what's your opinion on that?
Well, caffeine itself is a vasoconstrictor, right? So it counter affects the vasodilatory effect of nitric oxide. So if your body can make nitric oxide and you're taking caffeine, you get chronic vasoconstriction, and that leads to stiff arteries. And with each heartbeat, you damage the endothelium, and it creates this really propagation of endothelial damage. So I think just with anything, you can't overdo it, right? It's everything in moderation. Too much caffeine is bad, it leads to chronic vasoconstriction. But I think, I don't avoid caffeine. I have a cup of coffee in the morning, but I don't drink caffeinated beverages. Well, I drink, a glass of iced tea typically with lunch or something. But I think it's in moderation, but people who are taking these other stimulant ridden drinks like the 5 Hour Energy, the Red Bulls, the Monsters, not only it's the caffeine, it's all these other stimulants that lead to vasoconstrictin, and they're deadly. They're dangerous, and it leads to vascular disease. It's leading to heart attacks and strokes in young athletes when they're out there trying to exert themselves, and the coronary arteries can't dilate to increase the metabolic demands on the heart, and they have heart attacks and die, fatal heart attacks.
Wow. And let's talk a little bit about delivering nitric oxide, because I think my first or maybe second experience besides, nitroglycerin, under the tongue, or, nitro paste topically on the skin, was an intensive care unit seeing patients on inhaled nitric oxide to try to keep up, their blood vessels open.
Right.
What are some other ways for delivery of nitric oxide, or what are some of your preferred ways to deliver the nitric oxide?
Well, you make a very good point. Nitric oxide is a gas. So the first clinical use of nitric oxide was giving nitric oxide through a nasal canyon. And the first approved indication was for premature babies with pulmonary hypertension. Right. And that saved millions of babies' lives since it's probably late 80s when it was first approved. And then nitroglycerin isn't nitric oxide. That's an organic nitrate that the body then metabolizes into nitric oxide. So there's really only one way to deliver nitric oxide gas. It's through putting a nitric oxide gas in. Now, I was the first and only person to develop a solid dose form of nitric oxide gas. So the products that we bring to market actually deliver nitric oxide gas. We can detect it coming out of the mouth. We can quantify it. We can verify it. And we do that through a lozenge. So this lozenge I created to have a certain composition, a certain matrix, a certain dissolution rate. So when you put it in your mouth, it takes 5 to 6 minutes. And as that lozenge is falling apart, we're generating a certain amount of nitric oxide over a very finite period of time. So that's really the only way to deliver nitric oxide. You can deliver it in a capsule. You can deliver it in a gummy or a chew, as some companies out there are claiming. And so you have to be careful. So that all these nitric oxide products, most of them are giving you precursors and substrates and hoping your body can convert it into nitric oxide. But in patients that have overt disease, whether it's Alzheimer's or heart disease, they've lost the ability to convert those substrates and precursors into nitric oxide. So that's like putting gas in a car with a blown up engine. It's not going to get you anywhere. And in fact, many clinical studies show that it can do more harm than good. So I tell people, you just have to be careful. In an inpatient setting, the only way to deliver nitric oxide that's clinically approved is through inhalated NO therapy, the organic nitrates that are delivered transdermally or sublingually for ischemic heart disease and angina. And other than that, there's no clinical use.
So, well, I mean, clinically, we would, start patient on IV nitroglycerin drip, and then nitric is converted. But, but the people we're talking to here hopefully are not going to end up in the hospital. So that's our diagnosis.
And even sodium nitroprusside, for hypertensive crisis, it's metabolized into, and that's why it works. But no, prophylactically, and where people can do that is, the lozenge generates NO gas. So our whole premise was, if your body can make nitric oxide, then we got to do it for you, right? It's like hormone replacement therapy. If your gonads aren't making testosterone, you got to take it. But we also understand the biochemistry and enzymology that we can recouple the NOS enzyme. We can restore the ecology of the microbiome. And now we're improving the body's ability to make nitric oxide on its own. So that's really the best approach. And there's no other product out there that does that than our orally disintegrating tablets. So if your body can't make nitric oxide, we do it for you, but we fix the reason your body becomes deficient. So in a perfect world, you would need less and less of this product over time. But because we live in a toxic world and people don't eat a very good diet and we're exposed to environmental toxins and we live in a toxic world, it's recommended that people take this at least once a day as kind of a daily nitric oxide support or nitric oxide boost.
Can you describe me, one of the things I found striking is when in experiments where they measure nitric oxide levels in blood vessels as people get older, there seems to be, as people get older, the amount of nitric oxide goes down, down, down. Why do you think that is?
Well, in these studies, they look at the ability of the endothelial cells to produce nitric oxide. So in these studies, they'll infuse like acetylcholine or bradykinin or what we call an endothelial agonist that would turn on nitric oxide production if the eNOS enzyme is functioning. And the data tell us that the older you get, we lose about 10 to 12% of that function per decade. So by the time we're 40 or 50 years old, we only have about 50%. When you get 70, 80-year-old, you're down to 10, 15%. And the underlying mechanism for that endothelial dysfunction is oxidative stress. And it's oxidation of an essential cofactor called tetrahydrobiopterin. In fact, the oxidation of BH4 is the rate-limiting step in NOS coupling and the function of the nitric oxide synthase enzyme. So now we have to, one, preserve the redox potential and the balance of the tetrahydrobiopterin molecule. And so we know how to do that. We can prevent oxidation of BH4. We can maintain NOS coupling. And now we can actually prevent that age-related decline in nitric oxide function, which has never been done before, by the way.
That is definitely exciting. In the last few months, what areas I know you're doing the research, what areas excite you the most in terms of the future of this whole field? Whether in your lab or elsewhere, where do you see this field going in the next year?
Well, I don't think we need any more basic science research, right? We've got to translate the basic science into clinical medicine. And I think, to me, that's the most exciting. I'm trained as a basic scientist, but the reason I got into this was we could make an impact in giving you physicians the tools and that you need to treat, prevent, cure, and diagnose disease. So for me, it's very clear, and I'm convinced that this is the future of medicine. It's the way we're going to treat patients for the next 100 years, because what we're finding is that nitric oxide at the right dose, at the right time, in the right patient, there's really no clinical indication where it would not be beneficial. So we're taking, through my drug company, Bryan Therapeutics, we're taking nitric oxide drugs into clinical trials for ischemic heart disease. We know that nitroglycerin and isordeal are effective for acute treatment of angina, but because patients develop tolerance to these drugs, they're not an effective long-term treatment strategy. So we can reduce, the induction of exercise-induced angina without tolerance development. So we're working on that clinical trial now. We're moving into Alzheimer's. Like I said, we get to the root cause of the metabolic disease of Alzheimer's, low blood flow and insulin resistance. But for me, and this is personal because my dad's a paraplegic from a car accident in 1984, and I've been dealing with decubitus ulcers and treating decubitus non-healing ulcers and wounds for most of my adult life, even when I was a teenager. So we developed a topical nitric oxide drug that's very effective at wound healing. It's antibacterial, so it kills the infections that are found in most chronic wounds and diabetic wounds. And we increase blood flow to the wound bed. We get tissue granulation, and you can heal any wound. So, we treat wounds the same way we did today as we did 50 years ago. There's been no innovations in wound care. And I think this nitric oxide, for me, the Alzheimer's drug study and the wound care is really a game changer because it's an unmet medical need. There's been no safe and effective therapies developed. And I think that's where we come in and really change the landscape of medicine.
That is so exciting. One question that commonly comes up for me about nitric oxide is who should not be taking it. And normally the only group of patients I recommend stay away. And obviously before you start any supplement or medication, talk to your own physician. But
sure.
but the one group of patients I caution are those who are already starting out with low blood pressure. It's not common, but there are definitely some people out there whose blood pressure is already too low. Did you agree with that? And are there any other categories where, red flags like, be careful with this?
Well, as you know, dose dictates poison. There too little nitric oxide is bad, too much nitric oxide is bad. And the dose is determined by hypotension or low blood pressure and methemoglobinemia. So when you develop a lot of nitric oxide, you can oxidize the iron of hemoglobin and reduce the oxygen carrying capacity of blood. So in the amount of nitric oxide that we deliver, we're very deliberate in what's called restorative physiology. We know how much nitric oxide a human body would normally make, and we only give that back. And interestingly, I thought the same thing probably 15, 20 years ago. In a patient that had low blood pressure, you probably shouldn't take nitric oxide. But here's what we're finding. People that have low blood pressure typically have thyroid issues, right? Thyroid is the controller of the basal metabolic rate and basal tone. But we've done 24-hour ambulatory blood pressure measurements in patients with hypothyroidism and, even blood pressure of, say, 100 over 60. And we give our nitric oxide, and there's no further reduction in blood pressure. I'm always, the N = 1, where I test on me first. My blood pressure throughout the day is typically, 118/7. And if I put a lozenge in my mouth, my blood pressure does not drop. I don't get orthostatic hypotension. I don't get syncope. I don't get lightheaded. So it's regulatory by nature. If you have high blood pressure, it's going to normalize your blood pressure. If you have normal or low blood pressure, it's not going to further reduce your blood pressure at the doses that we're delivering. Now, if we increase the dose, which we may in some of these clinical trials, because the demands of any particular clinical indication may necessitate that we increase the dose, but then we would exclude patients with low blood pressure. But in the general population, in the supplement space, we really haven't found any patient that would not benefit from nitric oxide.
Yeah, the fascinating thing, you mentioned like 100/60. I remember seeing a paper from, I don't know, 70, 80 years ago, looking at blood pressure in people in Africa, third world countries, not on a Western diet, on, eating lots of plants. And interesting, as they grew older, their blood pressure in normal people went down to like 100/60. Instead of in Western worlds, your blood pressure goes up as you get older. But if you're eating lots of plants, actually you're healthy at a blood pressure of 100/60. So, I mean, I think we have to be careful, because just because 120/80 is considered normal, it doesn't mean that's the ideal blood pressure. But I understand you're designing studies and you have to get it past boards and things like that.
No, that's right. Yeah, I think, in those populations, we didn't have fluoride in our drinking water. They probably had poor hygienic practices. So there was a diverse microbiome in their mouth. They were able to generate a lot of nitric oxide from the plants they were eating. They typically were eating raw food. They weren't cooking it. It was just a different world then. So, and you make a very good point. What's so-called or common now is not necessarily normal, right? It may be common, but it's not normal. But we have to abide by the current standard of care and the regulatory boards, and we have to carefully select our patient population. That, for supplements, you just have to demonstrate safety, and we're very careful on the amount of nitric oxide that we produce is safe. For our drug trials, we not only have to demonstrate safety, but efficacy in specific clinical indications.
Got it. Are there any other exclusion criteria where you tell people, like, I understand the dose makes the cure, but are there any other populations of people you say, maybe start with nitric oxide, but go very slow?
These are people that are on different classes of medications. Polypharmacy is a problem in the U.S. People on many different classes of medication, and it's almost impossible to predict the interactions between drugs and how one drug is going to affect the metabolism of all these. And then you've got genetic SNPs that affect drug metabolism. So what I tell people that are on many different medications, and the one we really worry about are beta blockers.
Okay.
Right? Because if you're on many different antihypertensive medications, and one of those is the beta blocker, which basically controls the pace of your heart. And then if you take nitric oxide and you get an acute drop in blood pressure, the body's normal physiological response was to increase heart rate to maintain pressure. But if you're on a beta blocker, it chases your heart. You can't increase your heart rate. And we just say, use caution, consult your physician, not just with nitric oxide, but especially if you're on many medications. You have to inform your physician so they can mitigate the risk and give you an informed, kind of educated opinion on whether or not this would be good for you.
Oh, that's so true. Dr. Nathan, we've covered so many topics. I know we could literally talk for many more hours, but for the people watching today, what would you say are some important, maybe 3 or 4 take-home messages that they should leave with today?
Yeah, I think most importantly, just get a clear understanding of nitric oxide. It's important to understand the science behind it and understand, if you're using mouthwash or fluoride or antacid, completely shutting down your body's ability to make nitric oxide. So do your best, work with your healthcare provider, get off of these things. Mouthwash and fluoride is simple. You can make those decisions in your own household. Talk to your physician how you wean off antacids. You can't just stop these cold turkey. You'll get rebound acid production. And then just, a balanced diet in moderation, moderate physical exercise, sunlight. And if all else fails, we have product technology that does it for you. But it's really that simple. It's a complex science, but it's a simple solution.
That's awesome. And Dr. Nathan, do you have a website? Where can people find you?
Yeah, I send people to my educational website because I'm not here to sell you product. I'm here to provide education and science-based information. So that's drnathansbryan.com. I do a monthly blog. There's a 6-minute video in there. They'll kind of tell you all you need to know about nitric oxide. And then for those of you that are looking for safe and effective nitric oxide products, it's n101.com. That's 1N, 1O is an oxygen.com. So yeah, and I'm on social media, most Instagram at Dr. Nathan S. Bryan, LinkedIn, the same handle, Twitter at Dr. Nitric, and you can look me up on PubMed. I've published over 100 peer-reviewed papers, and I'm certainly searchable by most search engines.
Cool. And Bryan is spelled Bryan, correct?
That's right.
And if someone wants to reach out to you personally, I know you're a busy guy. You've got lots of, websites and social media. What would be the best way to reach out to you personally?
Just, you can use my personal email at drnathanbryan@gmail. It's drnathanbryan@gmail.com. I'll always respond. I get hundreds, probably like you, get hundreds of emails a day. So I'll always respond. It may take me a couple of days to get caught up, but yeah, any questions whatsoever, I welcome your feedback. I welcome your questions. The most important thing we can do is provide quality information and education to the masses.
Dr. Nathan, thank you so much, not only for your time here with me today for this interview, but really for moving this whole field forward over the last, decades. And I could tell you're leading this push forward. And again, I think nitric oxide is one of the key molecules of life, and to turn back the biologic age and for Alzheimer's and all these other chronic conditions. And it is really exciting to be able to share this information with the public. Thank you.
Well, thank you, Dr. Helman. Just stay tuned. We're just getting started.
Oh, perfect. All right.